Hi, this is Dr. West, and I am doing a summary discussion of the wonderful Zoom meeting that we just had for patients and wanted to let you know about the discussion related to COVID-19. Today is April 23rd, 2020. And we started the conversation by looking at current statistics, both globally and in our local area. Today, there are 2.65 million cases reported worldwide and more than 185,000 deaths reported worldwide. Nationally, the numbers are also high in the US and continuing to climb steadily. And in our local area, we have performed nearly 4.4 million tests and had 65,000 cases that are reported positive so far in the state of Virginia. In Fairfax County alone, we are now seeing an average of about 150 positive cases per day, and that number continues to rise slowly. We are anticipating a peak in this area for Northern Virginia sometime over the next 1 to 2 weeks. We talked a little bit about medical resources that are available for people. Many hospital systems are fully functional and not yet at capacity. The ones close into DC are a little more full than the ones a little farther out. My understanding at last measure was that Inova Fairfax Hospital is at about 65% capacity, and Inova Alexandria is close to 100% capacity, but they have the ability to move within the system to accommodate patients who really need ICU care. We talked about different ways to prevent the disease. We looked a lot at hand washing, being aware of our hands at all times and knowing where they are and treating any contact quickly with a few drops of germicide or with hand washing. We talked, and this was rule number 1 of the golden rules for how not to get sick. Rule number 2 was to learn how not to touch your face, which is very difficult since the average human touches their face about 90 times a day. But we recognize that the majority of spread comes from hand to face contact. So eliminating that makes a huge stride and allows you to really safely protect yourself from the virus. Rule number 3 is maintaining social distancing with 6 feet apart, and the 6 feet has to do with the distance of the spread of droplets as they're expelled from the mouth with talking, coughing, sneezing, etc. And also facial protection. Any kind of a cloth mask can be beneficial. It does not have to be an N95 mask to keep you completely safe. And I wear my mask to protect you, and you wear your mask to protect me. Certainly, if you have any symptoms at all, the goal is to stay home. If you must go out with symptoms, please wear a face cover. And then the 4th rule that we talked about was coming to the healthcare system. If you have symptoms at all or major questions about your overall health or well-being, call the doctor and talk with them. Many of the offices are offering telehealth services, including ours. And you would only want to go to the emergency room in the event that you were truly short of breath. And we addressed questions about masks. We talked about people's living arrangements, who they're at home with. We talked a little bit about the silver lining of this process and having more time with family and more connectedness through Zoom calls and telephone calls with the people that we love. And it's almost like a giant reset button, having a chance to take a look at our lives and pick up some hobbies or address some things that we have always wanted to do but never had the time to do. So I look forward to offering this information in additional weeks to come. We'll be doing these Zoom calls every Thursday at 12 noon. So please join us if you can. Thanks. Stay safe.